The rotator cuff repair has become one of the most common surgeries. The rotator cuff is made of 4 different muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. The most common muscle to be torn in the rotator cuff is the supraspinatus. The typical time for healing of the affected tissues would be 4 to 6 months, depending on the severity of the injury and the type of surgery required. The rotator cuff repair rehabilitation protocol will include 4 phases of rehab. Phase 1 of the rehab protocol is from 0 to 4 weeks post-surgery. The goals for this phase are to decrease swelling, decrease pain, increase passive range of motion shoulder flexion to 125 degrees, and increase external rotation to 75 degrees. There are many restrictions associated with Phase 1 of the rehab protocol. The patient must not lift any objects over 5 pounds with the surgical arm. They must avoid excessive reaching and external and internal rotation of the surgical arm. They must wear a sling for the first 4 weeks, must avoid behind the back movements. For the sake of this video, the patient will demonstrate 3 different exercises associated with Phase 1 of the rehab protocol. The first exercise is Codman's shoulder pendulum exercises. These exercises should be done in flexion extension, abduction adduction, and circumduction. We will do 2 sets of 30 reps in each direction with no resistance. This exercise warms up all of the muscles of the shoulder. The next exercise is the T-bar external rotation exercise. This exercise is active assistive external rotation. This exercise should be done in 4 sets of 30 seconds with no resistance. This exercise stretches the pectoralis major and the subscapularis while increasing range of motion. The last exercise in Phase 1 is seated active range of motion retraction. This exercise should be done in 2 sets of 15 reps with no resistance. This exercise targets the trapezius, the rhomboids, and the latissimus dorsi. In order to progress to the next phase, the patient must show passive forward flexion to 125 degrees, passive external and internal rotation to 75 degrees, and passive abduction to 90 degrees. Phase 2 of the rehab protocol is from 4 to 8 weeks. The goals in this phase are to decrease pain and inflammation, restore full passive and active range of motion, and allow healing of the soft tissue. Some restrictions associated with Phase 2 of the rehab protocol include not lifting objects over 5 pounds, no sudden jerking movements, no supporting body weight with surgical arm, no excessive behind the back movements, and limited overhead movements. For the sake of this video, the patient will demonstrate 3 different exercises associated with Phase 2 of the rehab protocol. The first exercise in Phase 2 of the rehab protocol is the isometric wall internal and external rotation exercise. This exercise should be done in 2 sets of 30 seconds on each movement. This exercise targets the rotator cuff muscles, the pectoralis major, the latissimus dorsi, and the deltoids. The second exercise in Phase 2 of the rehab protocol is the isometric wall flexion and extension exercise. This exercise should be performed in 2 sets of 30 seconds for each movement. In flexion, the muscles that are targeted are the deltoids, the pectoralis major, and the coracobrachialis. In extension, the muscles that are targeted are the latissimus dorsi, teres major, and the deltoids. The third exercise in Phase 2 of the rehab protocol is the supine cross chest stretch. This stretch should be done in 3 sets of 15 seconds. This exercise stretches the infraspinatus and the teres minor. In order to move to Phase 3 of the rehab protocol, the patient must demonstrate full active range of motion compared to the other side. Phase 3 of the rehab protocol is from 8 to 12 weeks. The goals in this phase are to decrease pain and inflammation, gradual restoration of strength, power, and endurance, and gradual return to functional activities. Some restrictions associated with Phase 3 are to avoid sudden movements, to avoid pushing and pulling heavy objects, no aggressive strengthening exercises, no heavy lifting over 5 pounds, and no overhead movements. For the sake of this video, the patient will demonstrate 3 different exercises associated to Phase 3 of the rehab protocol. The first exercise in Phase 3 of the rehab protocol is the full can exercise. This exercise should be performed in 2 sets of 20 reps. There should be no resistance to low weight resistance, which would be 3 pounds maximum. This exercise directly targets the supraspinatus. The second exercise in the third phase of the rehab protocol is the side-lying external rotation exercise. This exercise should be done in 2 sets of 15 reps and should be done with low resistance, which is 1 to 3 pounds. This exercise targets the deltoids, the latissimus dorsi, the teres minor, and the infraspinatus. The third exercise in Phase 3 of the rehab protocol are wall push-ups. Wall push-ups should be done in 3 sets of 5 reps, and your body weight should be the only resistance. The muscles targeted in this exercise are the pectoralis major, the deltoids, the latissimus dorsi, the rhomboids, the trapezius, and the serratus anterior. In order to progress to Phase 4 of the rehab protocol, the patient must be able to do strengthening exercises without pain. Phase 4 of the rehab protocol is from 12 to 24 weeks. The goals in this phase are to establish and maintain functional range of motion, progress muscular strength, power, and endurance, and return to normal activity. The only restriction in Phase 4 of the rehab protocol is to not overdo the exercises, as this will increase the risk of re-injury. For the sake of this video, the patient will demonstrate 3 exercises associated with Phase 4 of the rehab protocol. The first exercise in Phase 4 of the rehab protocol are the shoulder stabilization exercises in all directions. These exercises should be done in 2 sets of 20 seconds in each direction. The shoulder muscles resist the movement. This exercise targets all of the rotator cuff muscles. The second exercise in Phase 4 of the rehab protocol is the door stretch. The door stretch should be done in 2 sets of 15 seconds with no resistance. This exercise stretches the pectoralis major and the subscapularis. The third exercise in Phase 4 of the rehab protocol are push-ups. The push-ups should be done in 2 sets of 10 reps, and body weight should be the only resistance. This exercise targets the pectoralis major, the deltoids, the latissimus dorsi, the rhomboids, the trapezius, and the serratus anterior. In order for an athlete to progress to sport-specific exercises, the athlete must demonstrate symmetric motion and strength, normalized scapulothoracic kinematics, and no pain at rest or with activities. When the athlete has no pain at rest or with activity, has full strength in the muscles across the shoulder, and has pain-free shoulder range of motion, the athlete may return to play.